Sorry. So like I was saying, the human resource aspect is also very important. And recruitment, training are all part of it. You look at the deployment of these individuals are also part. Where are they sending them? And then even their exit, when they get to retirement age, how do they exit the organization? So all of these are important when it comes to human resource. It's very important. And then a senior management commitment. So it is very important that the management is key of these people. The recruitment as drivers is something that is dear to their hearts. Then you also talk about technical training and the managerial aspect of it. All of these are very important to them to be able to work, because when people are working and they know they are going home with nothing, that actually discourages them. So just like us, we are working and you are about to go into retirement and you know what you are taking home cannot take you home. Just like the salaries. At the end of the month, you went for a salary and your salary cannot take you home. So there's a problem.
You will die early.
You will not be happy. So if they have the opportunity, this is transport. If they have the opportunity, they can go and dump you somewhere. So you must also treat the drivers well. As whether we treat all the workers well in this country, that is another thing that we can talk about. But if you don't treat your drivers well, then you know that you will die soon. Because they are in charge, they are driving you around. So you must also, as much as possible, treat them well so that they can feel comfortable when they are driving you. But when they are driving, you are enjoying. You go for workshop, you take your money, you don't remember them as a human resource component. You should also know that one day they will put in that some ditch and that will be the end for you. So please, let's take care of our staffs, especially the drivers, so that they can feel comfortable. So it's important that you address all of those things. The other aspect is the fleet management. That is, this body also relates to the selection and procurement, maintenance, repairs, disposal, replacements of the vehicle fleet. Effective fleet management is a basic requirement for operational efficiency, availability, and reliability. All the company work to ensure vehicle availability and reliability. So, but if you look at the fleet management, unlike the transport management itself, this one you are only talking about somebody who is in charge of the various vehicles that you have at the various facilities. Because this one we are not talking generally at the national level. When you get to the health facility, the kind of vehicles you do, who actually take care of those fleet that you have, or how you take care of your fleets. So all of these are part of it. How they repair it, there's disposable process and all that. All of these are part of your fleet management. So it is equally important that you look at the fleet management of your vehicles. Then going forward, you must also look at, even before we look at the transport, we have identified 5 of the issues that we have talked about now. if there is any question, I want to address that before we move on and look at the various aspects of the strategical management of the various portfolios within the Ghana Health Service, especially the vehicles, the type and what they are used for. So if you have any question, please ask the question so that we'll look at them and then we can progress to next level. If you have any question. But if you don't have any question, then we can look at all of this. These are things that are with us every day. We just look at them quickly and see that these are the kind of vehicles and the type that we have and what we use them for. So these are some of the issues that we can actually look at if we want to identify some of the vehicles that we have and what they are actually used for in our health facilities. So you can talk about motorbikes. Mostly they are used at the sub-district levels, and I already spoke about why they use them or the functions for which they are used. We talk about outreach program, how to reach areas where vehicles cannot go. It is the motorbike that take our people to those areas to conduct their services, especially our community health nurses operating from chief compounds and all that. We have saloon cars that we all know, used by directors for their administrative rounds and all that. We have the pickups that are also there. We have the hospital, there are pickups by the district hospitals and institutions for general service delivery. We have the stores that they have pickups for load conveying. We have the administration, outreach services, and the monitoring as well. We have the buses, small and medium, primarily used by the training schools. You see, health training institutions, they have them to transport their staffs and sometimes students to some fields, trips and all that. Then you also talk about ambulance service. Ambulance is there. That's why I don't even want us to look at all of this because they are with us. We are looking at them every day, what they are being used for. Ambulance also used for hospital, for conveyance of critically ill patients on transfer. And then we also have accident victims that are being taken. They also used for emergencies that we all know are there. Then the wagon station, the station wagons used by HQ, that is headquarters or regional health authorities or directories, and then teaching hospitals, and then the other institutions for monitoring and tracking. So these vehicles are also there that they are used for those purposes. And then we continue, we have bicycles are also there used by community volunteers for disease surveillance. So sometimes you must also motivate the community volunteers. And one of the things that they also like most that they should be movable. So you see them, some of the communities, they are giving community volunteers, they are giving bicycles to be able to use in the communities to reach out to others. So they are also happy when they have those bicycles that they are using in the community. They are seeing evidence of their work, they are seeing the benefit, therefore they continue to provide or use those services or help you to achieve your target. The surveillance is very important. Most of the community volunteers, they carry out those information to the health authorities and then onward action is taken on them. If we talk about the stores, the central medical stores and all that, is the Holy Trust that we normally use or the Ghana Health Service. We are using Ghana Health Service as a model, as I said from the beginning. Is that they use by the stores to convey stores and supplies to other areas. We have the water tankers used for supply of water to health institutions that are lacking water in some areas. Then we also have forklift used for unloading, offloading, conveyance, proper handling of stores and supplies. If you talk about forklift, most of them, when you go to the ports, the harbors, you see a lot of them. But Ghana Health Service, they also use, especially when those of you who watch when the COVID-19 vaccines were delivered to Ghana at the airport, you saw the forklifts lifting some of the consignment into the haulage track to be transported to wherever they are kept before being used for the vaccination. We also have the cold vans that are used for distribution of vaccines and the medicine needing transportation at a specific or prescribed temperatures. So the cold van is also the most of the time we see it, especially when we have to do polio immunization and all that. They are these cold vans straight transport the vaccines, and they specify temperature to the various facilities for onward vaccination or immunization to take place. Then we also have what we call bleeding van, that used for bleeding of the blood donors, people who have donated blood. Just that I haven't seen the bleeding van, but if anybody have seen it, you should let us know. I just read about it in part of our course outline. Bleeding van, that they are there, but they normally use for conveying those who donate blood, and eventually they themselves are bleeding. And then they also use that particular van because there are equipment that are in that van to help them stop the blood and also resuscitate them whenever their condition become critical. Then the haze, you all know what the haze is being used for, convey of a corpse or dead bodies from the facility to their homes or from the homes to the facility. In some areas, so the tractors are used for service delivery to communities that are cut off by river bodies. So areas that normal vehicles, motorbikes, bicycles will not be able to go. They also use tractors to be able to reach those communities, especially when they are cut off by water bodies that are not large enough that tractors can cut across, by normal vehicles may not be able to go through. Also used for service delivery in hard to reach areas. For example, in Ghana, you can talk about farm place, where most, especially boats, is shorter if you look at the journey. But if you want to use transport, you see how you go through a farm place and all that, how you go through a dry and a rest before you get to a farm place and all that. So all of those things are considered. These are some of the transport portfolios of the service. And if we are using Ghana Health Service as a model, then we expect to see some of these things out there. Any question before we continue? Any question? Any question?
No, sir.
My people, there are no questions. Okay. So we can look at the estate management department. When we move from transport, we can look at estate. The estate, we are simply talking about facilities, health facilities, accommodation, office apartments, the theater, OPDs, pharmacy, all of those things fall under the estate management. So the Ghana Health Service also have estate management department that ensure that hospitals, the facilities are there, they are in good condition, they are well maintained, especially maintenance, which is a huge challenge in this country, being properly monitored and ensured that our facilities are put to good use and they are always in a good state. So the hospital that we have, they build them. Some of them have been changed. They change their status to the teaching hospitals. Some of them have been changed from district level to regional hospitals. Some of them from clinics to polyclinics. Some of them from, many of them health centers to, so many of them. So they are in charge of these facilities. And you cannot work under the tree. Even if you are working under the tree, somebody must water that tree for you so that it continuously give you the shade that you want. So they are the one in charge of all of that. So they always ensure that all these facilities are in place for us to work with. So it is always important that we also look at some of the roles that they play. So the transport department is important. They ensure proper integrated planning and budgeting for optimal locations, the quality of health facilities that we have. They get the land from the chiefs if they have to pay for it. The central medical store, you know, last time, be able to put it up. The way the Rich Hospital was built recently, even though government gave out money, the estate department of the Ghana Health Service, they have a say because the architectural design that they want, and you know, it's a hospital. lifts are here and there. Once the level of the building to the other. All of these are things that estate department work on to ensure that they are safe. So it's also provide advice, yes, on kind of buildings that difficult to get the land. So they also advise on the story buildings in our various health facilities. And then one of the issues that we can also talk about is accommodation. Health staffs. Accommodation is always a challenge. Most of them are not properly accommodated and they move from far away. And I always make an example of a staff here which non-teaching staff have to move every day from Manfi. And somebody also moving from Koforidua every day to come to Accra to work and go back. You see, that is a challenge where there are some that are being accommodated accommodation. So that is also under the estate management department. What are the policies they have in place for their workers? And what is the policy on allocation of people locating accommodation to the people in the facility or in the Ghana Health Service? What are the policies in place? So the standard technical norms are also there and the management guidelines for contract administration at all levels. How do they construct or they sign or they come into contract agreement or sign a contract with bodies that establish, let's say, construct their hospitals, their accommodation for staff and all that. All of these are things that I look at. And it is one of the departments that are also, if you want to see corruption, you can see it here because they sign most of the contracts and also select the kind of people to work for them. So all of these are important that you must always look at. So they have a key function that they play. And in addition, it also ensures proper acquisition and legal ownership of health estate and maintain database on all the health estates. So when we talk about health estate, I'm only talking about the clinics across the country, the chief compounds and the chief zone across the country, district hospital across the country, regional hospitals across the country, all the health facilities that are under government, that is public health facility that we have. It is their responsibility to take charge and ensure that the land is properly documented to avoid encroachment in future. Just like what is happening currently at, how do you call it, Pantine Hospital, where people have been encroaching on their lands, taking it by force and all that. If there's a proper documentation and all that people are doing, you can take them to court and allow the law to take its course. So it is the responsibility of the estate department to also ensure that all these things are done and done properly. Then beyond that, you can also look at the management of health information system. Health information is very key. And the privacy of the health information is also very important. So how do you manage this computer age where everything that is here is being seen other parts of the world? How do you manage that so that people's health information are not seen by others? Yes, Esther, ask your question.
Yes, sir. Before we move to the health information, I wanted to find out the estates management. Who is the head when you come to the hospitals? Because, for instance, in Kolebu, we have some of our estates that people are staying in, and they don't even work in the hospital. But they are staying in, and sometimes some of us have problems with those things. And as you said, people are working in the hospital and they're coming from far away to come and work and go to their various homes. Like, who is the overall head of all these estate people in our hospitals?
Most of them are appointed by the medical director. For example, they appoint a chief executive officer. So they are individuals who are working within the hospital, but they also have some expertise. Most of the time they call them and train them on this facility management. So they are people who have some expertise in that area, and they are being put in charge of this. So sometimes they allocate this facility to their friends and cronies. I'm not surprised that you are saying that people are living there and yet they don't work in the hospital. I have seen in the area that a whole hospital facilities are there, and people who are staying there, they don't even work in the hospital. They work at different places, but yet they have accommodation there and people who are working in the facility, they do not have. So mostly it's about for the appointment of people who are in charge. They are done by the chief executive officer of the facility. So people are appointed to be in charge, and they reallocate this hospital to sometimes they are cronies. You know, even though they are, some of them are asked to pay for their accommodation. But if you compare it to the commercial market, if I say commercial market, those are building and renting, staying in those bungalows are far, far, far better. So they liaise, put ghost name there, and then rent it to their friends and take the money and all that. So that is how it is.
Okay,
Yeah,
sir.
so one thing that you can do, you have a concern, is go to the administration and find out. Those are in charge. And sometimes it's also good to write letters and put your name there, especially if you have evidence that people are staying in the area, yet they are not working in the hospital. And yet people who are working within that facility, providing services day in, day out, they are not housed. So these are things that you can also say, but sometimes you must also know how to say it. Other than that, you will be signing your death warrant, because people will think that you are coming to challenge them or tell them what to do, or you are trying to come and expose them, and therefore they can also take you on. But generally, we are supposed to be citizens, not spectators. So you have the right to go and ask, and also get to know. Just know that you want to apply for accommodation. What is the procedure? So when you say that, the person who don't know that you are coming with this issue, then when you get to the procedure, then later on you can come out with your petition. So just pretend as if you are looking for accommodation. Where you are coming from is too far. So you want to be allocated in one of the bungalows within the hospital, and just tell them now what is the procedure, and then you get to know exactly how it goes. And if you are not happy with the procedure, you can come out later and ask your questions. But if you don't know much, you go and ask questions. Sometimes you will not be able to get the right answer that you are looking for.
Okay, sir. Thank you.
You're welcome. Any other question? So the rest of you have been accommodated, so you don't ask any question.
We all have.
Yeah, we have not been accommodated, but
So,
we don't have any question. You go and they'll tell you it's for this man, it's for this big man, it's for this big woman. And you that you are coming from far, you will not get a place to do that.
yeah, it is true, my brother.
So
Yes.
see, one thing is that you
Yeah.
go to the facility,
Yeah.
the medical soup is having accommodation there.
Okay.
The administrators have accommodation, the pharmacists, all those people. And
Yeah.
those who we call during emergency are
Yeah.
living far away. The PA who you'll be called, the anesthetist who you'll be called, they are all in town. The administrator who doesn't have anything to do during emergency will be front at the gate. So
because because they are the people allocating the accommodation, so they consider themselves first. You see, that's how that's that.
Hello,
These
sir.
are some of the issues. Well, one day we'll change the system.
Suggestion.
Okay.
Like I wish this presentation should reach the high people, because if you get to the sub-district and those things, you see staff using their personal motorbike for the work.
Yeah. Yes.
And then we can get motorbike. So I wish this presentation could have meant for the people sitting at the high level.
But I don't think that you are also at the high level.
Yes. Myself.
Yeah.
My brother, you are talking as though you are talking as though
at the lower level. That's what I
no more than you do.
No, I didn't get you.
My brother, they know more than you do.
They know more than what?
He's saying that he's suggesting like this presentation goes up to the higher level, those in charges and
Those people, they
and
know.
I'm telling you that, and I'm telling you that they know. All those in charge, they know. Even the
they
man
are
at the
aware.
gate, guy, they know. But they will say that they came there before you came.
We are receiving
They are not going
4%,
to vacate
4%
anything.
increase in our salary.
The master group knows everything. They know.
Somebody
4%
have,
increment. So we are
somebody have
nothing.
brought, somebody have brought his salary increment. That's why I like mature students too. They are really experiencing the thing, so they will tell you how it is on the ground.
Oh, no.
It's not easy, say.
Yes,
Upon this
4%.
4% increment of salary, I'm still using my personal motorbike for the work. No motivation. What do you want us to do?
How about maintenance and fuel?
You keep quiet and
The guy
suffer.
was looking for it.
Do they give you maintenance and fuel?
For where? Ghana.
Oh, why?
Hi.
No maintenance and fuel. No.
Why are they afraid of you?
Oh, but have you applied? Honestly, have you applied?
Are you talking about application?
So
Yeah.
they will tell you NHS has not paid them. They will tell National
No,
Health
no,
Insurance
no,
have not
no,
paid.
no, no. That's not the issue. That is not it. You see, when you have, let me tell you one thing. When you have it, you are supposed to apply with your vehicle document to the Human Resource Department, and they'll forward to the national level. So it's not the facility that is supposed to come and pay you. They add it to your salary from the source, from the controller, so that at every month, you know that your fuel money or your vehicle maintenance, as at now, what I know is that they are paying maintenance. And you know, recently, the Next Military Council of Ghana, they signed a new condition of service. And if you look at that new condition of service, vehicle maintenance and the vehicle fuel allowance are part of it. And you are supposed to get that, and it's supposed to come from the national level. So if like you are depending on your facility to give you, that is, but you are supposed to send your document, bury your name, your A form of your vehicle or motorbike, and all of these things are done at the national level for you.
So, but before you get those things, you have to reach a certain level before you get that allowance.
You have to get to what?
A certain level before you get the allowance.
So it's not everybody that can get it.
Yeah, it is not everybody. I learned it is from PNO above who can get that vehicle something allowance.
Oh,
so it's
the
not
vehicle,
everybody.
So
yeah,
the
it's not everybody.
Vehicle maintenance VMA is not every.
It's not everybody, sir.
It's only for the senior
PNO above.
Really?
Yes.
That is Ghana.
So senior next officer are not supposed to get it.
No, unless you get to PNO before you give it.
PNO before.
Are you sure?
Sir, I was
the issue is that vehicle maintenance allowance. So far as you have vehicle, you can apply, but it is not from national. It's the facility. The only thing they get from national is the fuel allowance.
Okay.
From PNOs going, that's when they pay them controller. But for vehicle maintenance allowance, you apply to the facility to get it. They will not give it to you.
Oh, I see. Then it differs from what's happened under fields. Well, where I work is a bit out of the.
The truth of the matter is Ghana Health Service. If by the grace of God, everybody gets a better offer in different sector, we should go. Because in Ghana Health Service, I'm telling you, if you are working for them, they don't care about you. They don't care about anything about you. They don't. It's zero. Unlike the other service, like the customs, the military, the prisons, like you can see the channels are working. But in Ghana Health Service, Charlie, get yourself wounded. You, Master, oh yeah.
No, but what you are saying is only that when you stand here, you see the grass greener at the other side. All those that you have mentioned, there are other challenges too.
You just enter and see.
So it's a civil service in Ghana that is the challenge.
Their systems are working. In Ghana Health Service, if something happens to you, it is for free. Nobody will mind you. It is for free. Look at my brother that he's saying that he pour his motorbike, go on rounds and everything.
Yeah.
But God, if the day that God doesn't pass home and something happens to him on the way, you should ask him whether they'll come and look after him. Nobody will come and mind him. Nobody. They will just come and say, oh, you hear from us. You hear from that.
Wow.
Oh, Ghana Health.
Wow. That's interesting. Okay. It's not easy. I know one day we'll get there. So when we become the managers, please, let's manage properly.
Oh,
And
so
take
that
care
time,
of our...
then we are all dead that time.
Let's take care of our juniors. We don't treat them like the way you are being treated today. Yeah. So then let's move on if you do not have any other more. So we are talking about management information system. And I was asking you that nowadays, the world is a global village. How do you ensure that the information that you have here does not leak to the general public? Because the health of the people is supposed to be privacy. You don't share people's health information anyhow. What are we going to do? Let's talk about that before our system shuts, and then we'll log in. What do we do? The safety of the information out there, what do you do?
Oh, sir, please, I didn't get the question.
I'm saying that it's a global village now, and we are talking about information management system. And I'm asking, how do we put the information of our clients, our patients out there, but will not get into the hands of anybody, to ensure that we ensure the privacy of our client, the privacy of our patients?
Okay. So maybe you only take information that you need, and also the specific people must be designated to enter this information into the system and protected from maybe from the general public from getting access to the information.
Yes. How do
so
you...
by the use of computer systems like the HAMS and those things, where everybody who goes into the system have a specific code.
Okay.
So you cannot go there and enter any information. Even if you enter any information or retrieve information, your code will show it that this person has entered this place at this time.
Okay.
So that one can track people who are getting access to the system.
Okay. I think that's good.
And
Any
so
other?
the other one too is by respecting the patient's information itself.
Okay.
By keeping to not to disclose our patients, like taking their information to be highly confidential. That is what I want to say.
Okay. In other
Because
words,
you can have the code all
I
right.
think
You can have the code
I
all
think-
right, but sometimes when some cases come, for instance, those of us who work in the VIP wards and things, maybe you won't be on duty. A minister will come, he has this condition. Because of your code, you can go and enter and see all about the patient. But you must ensure to cover the patient's his confidence issues, take it at heart and not to bring it out. It's against our profession to do that.
Okay. That's good. That's leads to the
Yes, sir.
I'm sure you have all read about the patient charter.
Yes, sir, boss.
Okay. Yes.
So I think there are some cases. There are some cases in our profession. You have to share it with a colleague in a way to find a remedy or solution to that very client's condition. So in case of this, I would say that we should be professional in whatever we do as far as clients. Because coding alone, yes, it will help, but then that will not be the immediate solutions to handle the health system. I mean, or the privacy of our.
Okay. But you know, the health delivery is a teamwork. So the team that is working, they must all have the information so that they know how to address the issues. So that's the information for the team members. Yes, everybody will have, but we all know the system that we are working with. And now you know how patients are suing health professionals because of negligence. So when they catch up with you, you can be sued. and then the damages the hospital will allow you to pay. Even if you have to seize your salary to pay the damages, they are doing that. So let's continue to be professionals, even though we have a lot of challenges. We should continue to be professionals, and then the oath that we have taken, ensure that we provide all those all the time.
So,
Yes.
so some of us to we say things unknowing, which also breaches information.
I can hardly hear you.
Hello, sir.
Your line is not clear.
Hello, sir.
Yeah, I can hear you now.
Yes, I was saying that some of us to we give information out unknowing.
Yeah.
Especially when the relatives and the around.
Yeah.
So
Yeah.
it breaches information actually. So
Okay.
it must be strictly to be need to know basis.
Okay.
If we say yes.
Okay.
So,
And you
so
know,
that's my own answer.
that is important because you must always seek permission from your client before disclosing any information to their families and all that. So it's important that we always follow that. Our system is logging, so I'll log in, then we'll come, and then I think we'll finish soon and go away.